Let's be honest, when you think of the esophagus, you probably just picture a simple tube, right? Kind of like a passive pipe that just drops food from your mouth down to your stomach. But what if I told you it's actually one of the most dynamic and brilliantly engineered superhighways in your entire body?
Oh, you know the feeling. We've all been there. You take a bite that's a little too big, maybe you swallow a bit too fast, and bam, you get that uncomfortable pressure, that feeling of a traffic jam right in the middle of your chest. It's such a universal experience, but why does it happen?
Well, here's the wild part. That's not a design flaw. Your body has intentionally built in narrow passages along this route, so that feeling of something getting stuck, it's almost always happening at one of these natural bottlenecks. And understanding them is really the key to understanding how this whole amazing system works.
So to really get it, let's take a guided tour. Come on. We're going to travel the full 25 centimeter, that's about 10 inches, journey from top to bottom, and we'll explore all the unique neighborhoods and landmarks along the way.
Okay, first things first, the basics. The esophagus is this muscular tube, and what's so fascinating to me is that when it's not working, it's completely collapsed, kind of like a flat fire hose. It only springs into action the moment you swallow, expanding to make room for whatever's passing through.
Our journey starts right here, in what's called the cervical section. This is the very top part. It's a short little 4 to 5 centimeter stretch that lives up in your neck. It's the official handoff point from the pharynx, and it's what kicks off the food's big downward journey.
Next up is the main event, the thoracic section. This is the longest part of the esophagus by far, running the whole length of your chest. And you know, it has to navigate an incredibly crowded space, passing directly behind your windpipe, your trachea, and just behind your heart. Talk about a tight squeeze.
And for the grand finale, we've got the abdominal section. It's just a tiny 1 centimeter segment, but its job is absolutely crucial. It has to pierce right through that big, muscular sheet of your diaphragm to officially enter the abdomen and connect to the stomach. This is the final gateway.
Now, guarding the entrance and exit of this whole highway are two critical gatekeepers, the sphincters. You should think of them as muscular one-way valves. At the top, you've got the upper esophageal sphincter, the UES, that lets food in. And way down at the bottom, the lower esophageal sphincter, or LES, lets food out into the stomach. Their most important job? Slamming shut to make sure nothing comes back up.
Okay, so remember that stuck feeling we were talking about a minute ago? Let's zoom in on exactly why that happens by looking at those built-in bottlenecks. These are the anatomical narrowings, or constrictions.
The precision here is just remarkable. There are 4 key pinch points, and they're all measured from your teeth. So about 15 centimeters down, a muscle called the cricopharyngeus gives it a squeeze. A little further, at 22 and 27 centimeters, it actually gets indented by your body's biggest artery, the aorta, and the main airway to your left lung. And then finally, at 38 centimeters, it's squeezed by the diaphragm muscle as it passes through.
And this diagram just illustrates it perfectly. You can see that the esophagus isn't just floating around in space, it's being pushed on and indented by all these other vital structures. These aren't random narrowings at all. They're the direct result of fitting this tube into a very, very busy anatomical neighborhood.
So where do things actually get stuck? Well, the data is crystal clear. A whopping 70% of foreign objects get lodged right at that very first constriction, the cricopharyngeus at the top. The other two main spots, the middle and the bottom, each account for about 15% of cases.
So, we've seen the outside journey, but the real magic, is in the wall of the esophagus itself. See, it's not just a single layer of muscle. It's a super sophisticated 4-layer structure that performs a stunning biological relay race every single time you swallow.
If you go from the outside in, you've got the fibrous coat for structure, then the muscular coat, which is all about movement, then the submucous coat with blood vessels and nerves, and finally the inner mucous coat that your food actually touches. But really, the star of the show is that muscular coat.
Okay, this is, for my money, the most incredible part of the whole system. The muscle that makes up this wall, it actually changes its type as it goes down. It literally starts as a muscle you can control and then seamlessly transitions into a muscle that works completely automatically.
Just look at this comparison. The upper third is made of striated muscle. That's the same kind of muscle you have in your arms and legs. That's why you have conscious control over that first act of swallowing, but by the time the food gets to the lower third, the muscle has completely changed to smooth muscle, which is totally involuntary. Your body takes over, and you couldn't stop it if you tried.
And that's the genius of it. The source material puts it perfectly. It's a gradual, seamless handover. It's not like flipping a switch. It is a beautifully coordinated relay race, passing the baton from your conscious brain to your body's automatic reflexes without ever dropping it.
So, why does understanding all this complex anatomy even matter? Well, because when this finely tuned system breaks down, it leads to some very common and sometimes very serious medical conditions.
Let's start with the most common problem, a faulty LES. If that exit gate at the bottom doesn't stay clamped shut after food passes into the stomach, it lets harsh stomach acid splash back up. And that burning sensation, well, that's what we call heartburn or acid reflux.
But on the flip side, what if the LES doesn't open properly? This can lead to a condition called achalasia. In these diagrams, you can see how the sphincter just fails to relax, and that causes food to get all backed up. This blockage can actually cause the esophagus to get massively stretched out. On an X-ray, it often creates this really distinctive bird's beak shape because nothing can get through to the stomach.
Now, if that acid reflux goes on for years and years, the body tries to protect itself. In a condition called Barrett's esophagus, the actual cells lining the lower esophagus start to change. The normal pale pink lining transforms into a tougher red lining that's more like what's in the intestine, all in an attempt to withstand that constant acid attack.
But here's the dangerous trade-off. While this cellular change is protective, it also significantly increases the risk of developing a specific type of cancer called adenocarcinoma, and it's almost always located right in that lower section of the esophagus that's been damaged by the acid.
So, if there's one thing to take away from all this, it's that we have to completely upgrade our view of the esophagus. It's not just a pipe. It's a dynamic, multi-layered, neurologically complex, muscular superhighway with gatekeepers, bottlenecks, and a stunningly elegant system of control.
It's a process we do hundreds of times a day without a single second thought. But now you know the story. So next time you take a drink of water or a bite of food, just take a second to appreciate that incredible, seamless, muscular relay race that's happening automatically inside of you at this very moment.